The most difficult thing for me personally is just witnessing all of this death. I saw people die as a medical student, but back then, because you're so junior, you get a lot of support. The weird thing about coronavirus is it's not super deadly. There are much deadlier diseases that are more likely to kill you if you get them, but usually it spreads from surfaces. So you'll touch a dirty surface that has some coronavirus, then accidentally you touch your face.
Hi guys, welcome to Mochunkstv and welcome to another installment of Chit Chat with Mo. So last week we actually met a survivor, a patient who had come out of coronavirus. We met Toby Rachel, who managed to come out of the other side of coronavirus, and she's now well and good. And today we actually have a medical professional with us. Today on the show we've got Dr. Mo, my namesake, and he's going to speak to us about some things that happen. You know, he's on the front line, he works very closely with nurses, he works very closely with patients. So just to give you guys another perspective into what is actually going on whilst we're all on lockdown, and those that are actually facing this pandemic, hear from them on these talks. Okay, so Dr. Mo, hi, and welcome to the show.
Thanks for having me.
How are you feeling today?
Yeah, I had 2 long shifts for the last 2 days. I've got the whole of today off, so I had a nice lie-in, a nice break from work.
So I just want to get to know, as I said to the people, you're on the front line, you're doing an amazing job. Thank you so much. You are the people that we are clapping for, although I wish we'd do more than clapping for you guys. You guys are doing a terrific job. So I really just wanted to ask you a few questions, and hopefully you can give our audience an insight into some of these things that they might be wondering about as well. Yeah. Okay. So the first one is, give me an overview of what your schedule kind of looks like during this pandemic.
So the first thing I'll say is I'm a foundation year 1 doctor. So this is my first year of being a doctor. And so we're not stuck in any specialty yet. We're rotating every 4 months into a different specialty to give us a taste of everything.
Okay.
So before all this started, I was a surgical doctor. I was in the surgical department. And when the coronavirus pandemic happened, they made a decision that people would stay in the department they were working in. So people wouldn't rotate onto the next one. And that's to save people from having to go to teaching and induction and wasting all this time in the transition, where they can do the thing that they've been doing really well for the last 4 months. And that was the original plan. But the surgery department has been really quiet recently. And I think people are scared to come into hospital with their surgical problems. So our workload has gone down massively. We've also cancelled non-emergency operations, and that's also lessened the workload. And at the same time, there are other parts of the hospital that are obviously much busier, like the ICUs. So they made the decision that we'd work a lot of our time on ICU alongside doing the surgery.
Right. And what does ICU stand for?
So it's the intensive care unit or critical care. It's the same thing.
And do coronavirus patients come on the ICU?
When they're very unwell, yeah. It's now almost entirely coronavirus patients.
Okay. And how is your shift now different to your normal shift?
Yeah, so surgeons and anaesthetists, intensivists, all start at 8 a.m. instead of 9, which is what most doctors start on. Now we're starting at 8 and working 12-hour shifts almost every day, every day that we work. So we'll do 8 to 8:30 p.m. But actually the total number of hours hasn't increased. So we're working fewer days, but longer days.
Okay, yeah, so you have gaps in between, and then you do a bulk, right?
Yeah, exactly.
Right.
But the other doctors in the hospital do something called 3 on, 3 off. Where they work 3 long days, they get 3 days off. They work 3 nights, they get 3 days off.
Nice.
But it's hard to do something like that with us because we're covering both the teams. So they have to fit the ICU days around the surgical on calls, so we can still cover both of our duties.
Yeah, nightmare doing those rotas. Oh my goodness.
Yeah.
I can't imagine who's doing the admin for all of that.
One of my colleagues did it, actually, yeah. One of the doctors.
Okay, and I think one important question I really want to ask is, do you feel protected as a doctor? Do you feel like the NHS is doing all they can to make sure that you are okay, that the government is doing all they can to make sure that you are okay. You're looking after the people, but of course you have to look after yourself. So do you feel protected?
So I think I'm very lucky to work in a hospital where the staff and the managers have been planning ahead for a while.
Okay.
So before we were overran by coronavirus patients, we had stocks of PPE, we had our own personal masks that are really good masks we can take with us to see these patients. It's not the same everywhere, but at my hospital, I do feel protected, especially on the ICUs, which are the highest risk areas.
So do you feel like it actually varies, and does that have anything to do with maybe budget, or is it just how these hospitals are managed?
That's a really tough question to answer.
Mm-hmm.
Um, I don't think it's necessarily budget per se. I think
Okay.
there's a global shortage of these masks. That the world can't produce enough to meet the demand at the moment. No one
So
predicted that this would happen.
that's really interesting. Is it that you guys just had masks anyway, or were they bought specifically for coronavirus?
So they were bought specifically for coronavirus. They bought these reusable masks. Another thing that we've been doing is using the single-use masks. So the
Okay.
white kind of cloth ones that you see in the pictures, you see people wearing them in the public. We have those, and people are also reusing those.
Okay.
But there are hospitals where they don't even have the disposable ones to reuse. And that's what I've heard from my colleagues.
I mean, we've had, of course, like people that have passed away, doctors, professionals. So I kind of want you to describe, like, okay, apart from, I'm glad that your hospital kind of keeps you safe and clean and you got the right PPE. But I think, what do you think is the most difficult thing about working during a pandemic, and specifically this pandemic?
There's lots of difficult things about it. The most difficult thing for me personally is just witnessing all of this death. I mean, that's something that is part of medicine. I saw people die as a medical student.
Mm-hmm.
But back then, because you're so junior, you get a lot of support after you see that. So the supervisor will sit you down and say, how do you feel? And just talk through everything, get everything off your chest. So once you graduate, once you're a doctor, you just see people die and then you're expected to move on and carry on with the rest of your work for the rest of the day. I find that super
Right.
difficult. And it's also super difficult dealing with family members. I can't imagine how difficult it is for these family members to have one of their friends or family on the ICU, because we've blocked them off from visitors, so people can't come to visit their family, protect them from this virus. So we have to update people on the phone, and all they know is that their relative is really unwell on the ICU and they can't see them, and that is really difficult.
I think that's really interesting that you mentioned, like, also, like, not just the physical strain, but also the emotional strain. Doctors, as much as we're praising them, there is this element of we're not quite sure how they are, for example, deciding who to look after. And there's almost that kind of dare I say, demonizing of doctors in that sense. Like, why would you choose that person over me? Or generally demonizing the NHS as to why do you get to decide who gets care. But I think it's important as well to highlight that this is actually really emotionally draining on you guys as well. Imagine seeing death literally every day. Like, is it every day?
The unit I'm working on at the moment is like the spare ICU. It's one that didn't exist a month ago.
Mm-hmm.
And it's not full yet. It has just a few patients. But when I was up on the ICU, the main one, I don't know about every day, but multiple times a week, it stops surprising you after a while. And that was really depressing, just seeing myself almost become desensitized to it.
That's really scary. Imagine seeing something so much that's just like another one. Wow. I'm so sorry that you're going through that, Dr.
That's
Mo.
okay. So there are different ways that people cope with it. For me personally, I think it's super important to have interests outside of work that take my mind off things, like YouTube videos like this one.
Mm-hmm.
And honestly, that really helps. And just switching off, because when that happens, you can talk to your colleagues, you can get things off your chest. But then after that, there's not much you can do. And I just distract myself by doing the rest of the work. And the flip side of that is some patients are still getting better. And that's one of the most rewarding things. So yesterday,
Okay.
I saw someone being extubated, which means they're taken off the ventilator, they're taking the breathing tube out. And he did really well without the breathing machine, without the ventilator.
Yeah.
And those kind of experiences really help get you through. Just
Yeah.
focus on the positives as well.
Okay. And is there a chance of like cross infection? Like, can one patient infects another. And I'm
Yeah.
why surgery patients are running away from the ICU as well.
The weird thing about coronavirus is it's not super deadly. There are much deadlier diseases that are more likely to kill you if you get them. It's super infective. It's scary how infective it is. So we take loads of precautions to stop people getting it when we can.
Okay.
For example, almost every ward on my hospital is a coronavirus ward.
Okay.
But if you don't have coronavirus, you'll go to one of two special wards that are free of it.
Okay.
And if one person on that ward tests positive, they're taken off the ward immediately to protect all the others, because we know how infective it is.
And is it just through like air particles? Because obviously there's been so much that's come out about when you sneeze and when you cough, the aerosols that you breathe out, and when you do a little a sigh or whatever it is. Those are the ways. Is that accurate, or is it literally? Because I know I was speaking to a nurse and she was saying that if it goes on your skin, you're okay, but it's when it gets into your mucosa, so your nose, your ears, your mouth.
Yeah, exactly. So this is always evolving. I'll tell you my understanding so far, which is that it can spread through a variety of ways. It can spread in the air with aerosol, for example, but usually it spreads from surfaces. So you'll touch a dirty surface that has some coronavirus, then accidentally you touch your face, and then it gets onto the mucosa, so your mouth or your nose. And that's where it causes the infection. That's why it's so important to wash your hands. Now, it's interesting that you say aerosol can spread in the air, but it tends to do this in heavy droplets. So the droplets fall and land on the surfaces really quickly. This is unless you're doing certain medical procedures. So certain procedures that we do, we class as aerosol generating, which means that it whips up bits of the mucus into aerosol, and that stays in the air much longer. So for example, when you're intubating someone to put them on a breathing machine, that's aerosolizing. So in those situations, you get the virus in the air, but usually it settles from the air very quickly. I'm not sure whether coughing produces aerosol.
Okay.
If someone with the virus coughs, there is the virus in the air, and it can travel for up to 2 meters. That's what the guidance says. I'm not sure how long it sticks in the air or that, because this guidance is always changing.
How do you prioritize patients that need your attention?
So prioritizing is one of the most important things that we do as doctors. And also one of the hardest, unfortunately, because there are so few of us and there are so many people that need our attention. It's really important to focus on the things that are the most important and the most urgent. To be honest, prioritizing is a gut decision normally. It's hard to explain. But let's say you've got multiple calls from different nurses or other doctors asking you to do something for them, and you only have time to do a few. You just have to look at which patient is most unwell and put your attention, give your attention to that patient and make sure that's sorted. So it's about deciding who needs your care the most in that moment. Usually that's whoever is most unwell.
And is there anything like age that comes into it? Is there anything like previous medical conditions? Like, is it just literally right now you're the most unwell, or do other factors come into it as well?
So that's kind of my decision-making process as a surgical doctor. When I'm on call, I'm being asked to do jobs. Luckily, when I'm on ICU, the difficult decisions that you're talking about, like age, past medical history, those are made by the most senior doctors.
Okay.
Are you talking about decisions like who gets care and who doesn't? Because I know that's something we talked about before.
Ventilator, for example.
Yeah. So again, I'm not an intensivist, but I'll talk about my understanding of the decision process from talking to them and from working with them. So these decisions have always been super difficult. There have always been these really tough decisions on who gets ICU admission and who doesn't. It takes into account, will the patient benefit from it? What is the patient's wishes? Do they want to be on a ventilator? It's not a very pleasant thing to do. And what do the family want as well, especially if the patient can't make a decision themselves. So what you're talking about falls into that first category. Will the patient benefit from being on ICU? Will they benefit from having more invasive input from the medical team? And like you said, that is based on things like age, but also the person's health. Are they going to survive this ICU admission? It's a really, how do I phrase this? It's a real strain on someone's body to be on ICU. Wow. It's not a pleasant thing to have. It's not a pleasant thing at all. If you have a breathing tube breathing for you, your paralyzed a lot of the time. So your muscles are going to waste away while you're in bed, you're not moving. Like I said, it's a super unpleasant thing for the family because they can't see you, they just have to hear about your situation on the phone. But the aim is to give everyone who would benefit from ICU an ICU bed. And that's what I've seen at the moment. So we haven't had to turn anyone down because we're full, because they are doing this prioritization. Everyone who would benefit is getting a bed. So you prioritize people based on the things you mentioned, like age and medical conditions. But one really important thing that we look at is someone's independence. So if someone is moving around independent, they don't need help in eating, drinking, managing their finances, almost every one of those people will get an ICU bed if they need it. The people who aren't getting beds are severely disabled already. So maybe very old, not able to move around the house. And it's because those kinds of people would not benefit from being admitted.
That's a really good insight. Thank you so much for that. That's heavy. It's really heavy. That's such a sad part of, I think, this whole talk. Where would you say that we are right now on the corona, this curve that everyone's speaking about, that we hear on the news, and we might not quite understand it? Apparently, we've flattened it. Where would you say we are?
So if you look at the numbers on the news, it does seem to have flattened and it's starting to come down now.
Amazing.
And that's also what I've seen in hospital, because we've had much fewer admissions than we did 2 weeks ago.
Okay. People are being discharged?
Yeah, absolutely. Loads of people being discharged, fewer people coming in.
Oh, that's really good.
It's difficult to draw too many conclusions from my hospital in particular.
Okay.
It's a small hospital, and so we've been on divert for a while, which means ambulances haven't been coming to our hospital. They've been going to bigger hospitals in London because there has been capacity there. So what I've seen is a huge reduction. I think in reality there is a reduction, but a gradual one over the last week or so.
Okay. Can any doctor predict like when you feel like you might finally get to that place where it's safe to go outside again?
Because our experiences are so tied down to the hospital we work in, it's difficult for us to draw personal conclusions about the whole country. And also that decision about whether to go out again, it depends on the statistics for the whole country, not just one hospital, and also the decisions that the government makes about the future and how they want to manage it in the future. So one thing they might do, if they see the rates coming down, they might release the lockdown because they might want a few more people to get it in the time being, because then we build up immunity in the population sooner. From what I've heard of the government plans, they would like to keep the coronavirus cases at the healthcare capacity. So they want a small number of people to get them, but not to overwhelm the NHS.
Right.
If that's their aim, then there is lots of capacity at the moment. So they might release a lockdown to get more people into hospital while we can deal with them, instead of overwhelming it all at once.
That's really
depressing.
It is depressing, but it's really I find it really fascinating how these things work, because obviously like places like New Zealand have now gotten to that stage, and it's like, how viable is herd immunity? I think that's what scares like the general public, in a sense of, okay, so they release these lockdown rules now and people go out again. And okay, the NHS is not overwhelmed, but can everybody truly survive it?
So the vast majority of people that get it will be okay. Like I said earlier, everyone who would benefit from an ICU admission and a ventilator, at least in my hospital at the moment, all of those people that would benefit are getting these beds. And because I work in London, it's the most hard-hit part of the country, I imagine, or I hope it's the same across the whole country. And we're seeing these deaths, huge numbers of deaths, hundreds every day, despite everyone getting ICU care that would benefit from it. So one reason that might be is because these people would have died anyway, regardless of the help that they're given. Because this is such a new disease, when someone is hit really hard and becomes very severely unwell, there's very little that we can do for them. So the question is, would it make a difference to delay them getting the infection till later? I guess one reason to delay it is because we might have better treatments by then. And that's one of the best cases, I think, is for a longer lockdown. Because if we wait weeks or months before releasing the lockdown, we might have better medication, better treatments, better ways of managing these patients. And even over the longer term, a vaccine is a really promising thing that will change things.
Do you advise as a doctor, and maybe this is more social advice than medical advice, for people to still stay indoors even if lockdown rules are lifted, in a sense of if they know their bodies and they know themselves that, you know, if I was to get this thing, I'm a goner, would you still advise for them to stay indoors even after?
So I would always advise you to follow the government's advice.
Okay.
And the people that you're talking about that are higher risk, so maybe they have a problem with their immune system, or they have asthma, or they're taking certain medications, those people are being told to stay at home for 12 weeks
Mm-hmm.
regardless. So even if a lockdown is lifted, those people are being advised to stay at home.
Right.
And I think that's very sensible.
Yeah.
I don't imagine the government's going to say, fine, next week, okay, the cases have gone down, everyone leave their house. I think it'll be a gradual thing. They might go back to what they said before the strict lockdown, which is try to stay at home whenever you can. I would echo that. So if you don't absolutely have to leave the house, then don't. Even things like shopping and things you have to do, try to do them as
Sparingly as possible.
yeah, as little as you can. And it's not just people who are old and that are high risk. Even for young people like myself, I will probably be okay if I get it. But there's a chance that I don't even know that I have it and I'm spreading it to other people. And that's another reason to stay indoors, even if you're really young, you're healthy, and you have no symptoms. You should still be staying at home to protect others.
Do you think the NHS will change after this pandemic? And if so, how?
So I'm not sure what will happen in the NHS, but I can tell you what I hope will happen.
Okay.
And there are certain changes that have been made in my hospital and other hospitals that I hope will stay. And the main thing is that I feel staff are appreciated much more these days than they were before, even by the hospitals themselves.
Mm-hmm.
So before, if you parked in the slightly wrong area, you would get a massive fine. They've stopped giving those fines. There's now free food for staff for breakfast, lunch, and dinner, so they can work these long hours.
Mm-hmm.
Free coffee whenever you need. There's also a well-being center. So just a room in my hospital that has board games and sofas. You can just chill there for a few minutes when you need. And it might be expensive to keep all of those things, but it would be really nice if they keep at least some of them, even just free coffee that we can grab from the canteen whenever we need it. It just makes you feel really appreciated as a staff member.
Quickly, do you have like some tips for those that may be self-isolating at home?
I know it's very easy for me to say this because I'm lucky I get to leave the house. I don't know what it's like to have to stay indoors for ages. But yeah, I would advise people to stay at home whenever necessary and follow all of the government advice. Try and see it as a positive. I would really love to have all this free time and I would use it to the best that I could. So pick up a new hobby, pick up an old hobby, start a YouTube channel, just do something with that time that you wouldn't have got to otherwise if you had to go to work.
And any final words for us? Like, this was such a good talk. I think you really gave a medical insight as well to all of these things that are happening around us. But would you just like to just round up for us with any final words that you have for us?
So I'll just reiterate something that I've touched on earlier, which is that it was really bleak when I was talking about ICU and how unwell these patients are, seeing people dying. But it's important to remember that most people won't die.
Okay.
Most people have very mild or no symptoms at all. They might not even know they have it. And so if you're young and you're healthy and you're not worried about getting this yourself, you should still take this super seriously because of how easily it spreads. And if you're young and you stay at home, you're not only protecting yourself, but protecting others around you, like your family and anyone on the streets.
Thank you so much. This was really, really great, Dr. Mo. And I hope you guys at home as well really took something from it and gained some insight into the medical side and those on the front line that are helping us tackle this disease as well, stroke infection. And I wish you the best of luck. I pray that you stay safe. And I didn't even ask about, like, are you isolating from family and stuff?
Yeah, so I haven't seen my parents in about a month now, even before the lockdown, because they're obviously older. I just couldn't live with myself if I gave it to them, so I'm not taking that risk.
Yeah. So you heard him. Even he's self-isolating, so stay home, okay? Thank you guys so much for watching this video. Make sure you do like it if you liked it, share it with your friends, and also subscribe to this channel for more. Also comment down below on the things we spoke about, and please do subscribe to Dr. Mo's channel.
If you found this stuff interesting that we talked about today, check out Dr. Mo Zeina. That's my medical channel where I talk about my experience as a doctor and what it's like dealing with coronavirus.
Yeah, some really good stuff on there. Like he's literally got the camera in the wards as well. So thank you so much. Thank you very, very much. And I hope you have an amazing rest of your day. Thank you so much,
You too.
Chris. Yeah. All right then. All right. Bye.